Hello, welcome to my channel Joyful Easy. I'm so excited to have you here, and today I will be dealing with some issues on neuroplasticity, precisely ADHD. So we're going to find out the meaning of ADHD, the signs and symptoms of ADHD, the causes of ADHD, and how to live with it. So before we proceed, I may have to make this disclaimer. This video is not intended to give any formal diagnosis on ADHD or any other health issue. This video is solely for the intention of enlightening, educating, and sensitizing you on common health risk factors within the social circle, family, and the society at large. So let's proceed. What is ADHD? That's the question now. ADHD is Attention Deficit Hyperactivity Disorder. I'll say that again. Attention Deficit Hyperactivity Disorder. In a nutshell, ADHD is a common neurodevelopmental disorder of childhood and can transcend to adulthood if not properly taken care of. So the early diagnosis of ADHD is very important, because when it's diagnosed early, it can be properly handled and will not affect the adulthood of the person in question. Now, there are certain signs and symptoms you can find in a person that has ADHD. But before we go into the signs and symptoms, I would like us to get the statement of fact about ADHD, so there wouldn't be any misconception about ADHD. Number one, ADHD has to be medically diagnosed. Number two, there is no specific lab test to the diagnosis of ADHD. Rather, there are a series of tests that will be carried out before they can get the final diagnosis of ADHD. Number three, ADHD treatments can help in managing ADHD but cannot completely cure ADHD, which means ADHD, according to what studies have shown, is a lifelong sickness. Number four, ADHD is found in patients with depression, bipolar disorder, anxiety, learning disabilities in children, and autism, I think. Yeah, autism. So, and so many other cases that you find the same symptoms of ADHD with people who suffer other related medical health issues. It's very important we know that ADHD is not directly related to dementia, because there is this notion of people that when you have ADHD, you have the tendency to have dementia. The answer is a complete no. ADHD does not lead to dementia. Even though ADHD can increase the chances of someone having dementia, it is not directly related. It does not cause dementia. So many people don't go to the hospital, or many people don't try to see the doctor when they have been diagnosed of ADHD, or when they've noticed the symptoms and signs of ADHD. They don't want to go to seek professional help or medical attention for fear of being termed or stigmatized as someone who probably has dementia. So that's a notion that has to be dismissed completely. And so we go to the signs and symptoms of ADHD. Now, the signs and symptoms of ADHD differs in children and adulthood. So you don't forget that ADHD can metamorphose into adulthood stage. And so the signs you get for children is a little bit different from what you get when you see an adult with ADHD. Number one sign that you get for a child that has ADHD is that the child daydreams a lot. The child daydreams a lot. You know, some children, you say them, they are lost in thoughts. I mean, it's too early. What are they thinking about? You have to, snap at the child so the child wakes up and comes back to consciousness. That's the sign. Number two, the child tends to talk a lot. Children naturally talk a lot. So you understand what I mean by a child talking a lot means it's extreme. It could be a possible sign of ADHD. Number three, the child squirms and fidgets. Some children can't sit in one. You see them, they twist their body a lot, wriggling and wiggling at the same time, When you look at such child, it's very uncomfortable, it's not stable, it's always wanting to jump from one place to the other. Children jump a lot, so don't misquote or don't misunderstand me, but you should know when this thing is is in the extreme. Number 4, you notice that the child takes very high risk, doesn't think about safety. You could see the child just wanted to jump, and you see some parents saying, come and see my child, wonderful, this is beautiful. What if you were not there, to monitor the child at that time? The child could probably injure him or herself, because that's very dangerous, taking very high risk, and so that's one of the signs of ADHD in children. You also notice that the child has trouble taking turns. You see some children, they are very impatient. If you bring out something you want to share with other kids, they will jump from the back as if someone taught them, and they will run to the front and almost grab that thing from the hands of the person that is sharing it. They are not patient. They believe that they cannot wait. They don't stay in queues. They don't take turns. Normally children grow by process. When you're training a child, you notice the child starts sitting down, from sitting to crawling, from crawling to walking and all that. So the child is used to process. So when you see a child that always boycotts process, there's something wrong somewhere. Every time you see that child at that young age, it boycotts every process. I'm not talking about sometimes, almost every time. The child never waits for process. That could be a sign of the child having ADHD. Some of these things we praise, something we should look out for, And so sometimes you notice that the child forgets things too much and loses things. You give the child, take this to this person, and the next thing you hear is lost. Even with situations where you will give warnings, educate, train the child on how to keep things, you notice that the child cannot just keep things, keeps losing things, and keeps forgetting what you told the child. The child will say, "Oh, mommy, I forgot." Keeps forgetting. If you will even notice it as a parent, that the child is very, very forgetful. You need to watch out for the signs that it could be a tendency that the child has ADHD. And then you have the symptom of the child finding it difficult to relate with other children. Children they have very minimal antisocial tendencies. Once they see a child, even if they have never met their playmates, their child, they just turn the child to a playmate instantly. They don't think, they don't check things, like adults. They don't even consider or reminisce on anything. They just go further and make friendships and socialize and play. But you find out that this particular child hardly ever wants to socialize, and even when he goes around other children, is not able to relate with them, is always fighting, never coming to agreement with any child, never has any child as a friend that he chooses or she chooses. He's always antagonistic. Then you need to check that child. There's a tendency that the child has ADHD. And so for the case of adults, notice that the adult has difficulty in the workplace because of lack of focus, lack of concentration, and not being able to also remember things. But it shows in lack of focus. It shows in the final presentation at workplace. So you find out that that person has very poor intrapersonal communication skills, very poor interpersonal communication skills. And so when you lack these communication skills, it's very difficult for you to cope at workplace. And so you start discovering that they have a lot of complaints about such persons at the workplace. And so you find that the person that also have difficulty at the home front is not able to manage family issues. It becomes too difficult for the person, cannot control his emotions on issues surrounding the family home front. So that could be a sign. You find out also that the person is not able to manage relationships. You see, the person cannot keep any relationship. Every relationship is toxic, to the person, and he also is toxic to other people. So is not able to maintain a relationship is a sign of ADHD. At older ages, you find out that there's extreme restlessness. The person can't stay in one place. You see some adults even telling you, I don't know, I have a brother or I have a sister, or the person even telling you, him or herself, that I can't stay in a place. I mean, if I stay here, it's as if something is pinching me. He's always looking for where to go, activity to keep himself, cannot focus. Those are complete signs and symptoms of ADHD. So we have to learn how to manage these signs and symptoms. But before we talk about the management of the signs and symptoms of ADHD, I would like us to talk about the causes of ADHD. Okay, so let's talk about the causes of ADHD. Scientists are still studying the direct cause of ADHD, and they have not come up with any direct cause yet. There's no very cogent, reason associated with ADHD. Okay, so but however, there are relative factors that can be linked, with ADHD. Number one, very critical factor is ADHD is genetically linked. Recent study links genetic factors with ADHD. So probably there are hereditary factors. The person was born with ADHD. It wasn't as a result of some social influences or factors or any sort. That person just came up or was born with ADHD and has to be dealt with. And then apart from the genetic factor, there are other relative factors that can be associated, as the cause of ADHD. And one of it is brain damage. Sometimes people involve themselves in accidents and they have brain injury without even knowing that they sustained some level of brain injury. So you just live with it, and the effect is ADHD. Number two cause that we can relative cause is exposure to environmental risk, such as exposure to lead during pregnancy and at young age. Pollution, environmental pollution, there are certain kind of environmental pollution that can affect the person at the time of pregnancy and at a very young age. Number three, you have alcohol and the use of tobacco during pregnancy can affect the child and can make the child have ADHD at birth. And so premature delivery can also be a relative cause to ADHD. And the last but not the least is low birth weight can lead or can also be a relative cause of ADHD. And so we go to how to handle or how to manage the symptoms and the signs of ADHD. So how do we manage the signs? How do we deal with the symptoms of ADHD? Number one, very important, you have to develop a healthy eating habit. Health, your eating habit is everything concerning your health. So you need to develop a very healthy eating habit. And when we talk about a healthy eating habit, you're talking about eating more of vegetables, fruits, choosing more of lean protein, eating more of whole grain foods. So that can help you manage ADHD properly. And so number two is you have to learn how to participate in physical exercises, like physical activities like exercising. And it has to be age related because children are also involved in this. So if it's a child, involving the child in some physical activities, you have to do some age related exercises, age related activities, not just exercise. There are some other activities that can spontaneously push you out of that extreme state of ADHD. And then you have to limit the amount of screen time you give to yourself, like the use of your computers, your laptops, your phone, and other electronic devices. People often relate too much of screen time as a cause to ADHD, but it's not a direct cause. But however, it can not reducing the use or reducing your exposure to your screen can actually help you improve your mental health states regarding ADHD. And then getting the recommended amount of sleep can also help. You need to sleep well. Find out the recommended amount of sleep you need to deal with the issues of ADHD. So don't just take the normal sleep time. Find out from your doctor. That's why you need to consult a professional on that. Okay? And so diagnosing ADHD usually includes a checklist for rating ADHD symptoms and signs, and also taking a history of the child from the parents, the teacher, the siblings, and even the child. Yeah. Okay, so treatment of ADHD is a combination of therapy and medication. So you can treat ADHD by going to a therapy session and having medication from the prescription that has been given to you by a professional. And so for you to get help for ADHD, you need to seek professional help. We can treat ADHD, we said so, but cannot exactly cure ADHD. In the case of the preschool aged child that is diagnosed with ADHD, it's recommended that the parents be trained, on how to handle the child, so that the parent can be able to manage the situation adequately. And so I would like to wrap this up right here. If you have any question, put it down on the comment section and I'll be glad to answer your question. And so if you like the content of this video, please like and share this video. Don't forget to subscribe to my channel and turn on your notification bell so you get to receive all the videos I post in this channel. Thank you very much. See you on my next video.